So what we are going to talk about today, guys, is all about our COVID-19 journey. What's up, you guys? Welcome back to my channel. If you are new to my channel, please don't forget to subscribe. Turn on the notification bell for you to get updated for all my future uploads. By the way, my name is Raymond, your Pinoy nurse here in Ireland. Okay, so I am back. I really don't want to come back with this kind of content, but here it is. It was 2 weeks of roller coaster of emotions, anxiety, and fear. Really. And I just want to share with you guys this story because I want to raise an awareness that COVID-19 is a serious matter, guys, and we should always keep our guards up. Let's not take this for granted because it can be very serious. And before anything else, guys, I just want to thank you for all your well wishes, the messages, the calls, the support that you have given to my family. From the bottom of my heart, guys, I really appreciate all those kind of gesture, and you guys are really awesome. Thank you so much, guys. It was a tough 2 weeks for my family here in Ireland. I don't know, I couldn't explain the anxiety and fear that we felt. So it all started Monday last week, the 20th of June, when we noticed that Zach started to have a cough that just very sudden. You know, he was just playing in the park, and then we noticed that he was coughing. We knew that there's something wrong. April of this year, Zach also had this kind of symptoms, cough and cold with fever, like 3-4 days, and we went to the GP. He was given antibiotic, and also happened last month, May, and same symptoms. It lasted like for 4 or 5 days, and also treated with antibiotic. So yeah, on that night, he started to have high-grade fever, just very sudden high-grade fever. So that's from Monday, so continuous fever until Thursday. So with that symptoms, guys, we already gave him some paracetamol round the clock. So we started that already just to relieve the fever. And the next day we contacted the GP. So good thing is our GP is on the next building only. So we contacted the secretary to book an appointment for consultation. But unfortunately, there is no slot. So it's fully booked. So according to the secretary, since Zach is having a persistent fever and started to have a really bad cough, continuous cough. So we were advised to go to the hospital, the A&E. So we went to A&E. So that's Connolly Hospital here in Blanchardstown as well. And there's a children's health department there. So we went there. He was checked there. He had an x-ray. So the x-ray turned out to be clear. He was cleared to be discharged home. So we went home. We were just advised to give Calpol or paracetamol around the clock, and they added Nurofen. So this is ibuprofen. So it worked with Zach. Fever will be subsided for like few hours and then come back up again to 39.6, 39.4. So it's like persistent fever and unceasing cough. So the next day, we contacted the GP again if we can book an appointment, okay? But unfortunately, there's no available slot, and we were put on a waiting list. And according to the secretary, if by any chance that Zach needs an immediate medical attention, we can contact DDoc. So DDoc, or the North Doc, it is a medical service that is available after hours, because the GP here runs only business hours, like until 4 or 5 p.m. only. Luckily, our GP is affiliated to DDoc, so we contacted DDoc on that night, on Wednesday night, and we were advised to go to the community health center. So we went there to Huntstown Community Center on Wednesday night around 9:30 actually in the evening. Urine sample was sent and they tested it, and it's clear because they were just using the dipstick. So it turned out okay. And the lungs are pretty much okay as well. It's clear according to the doctor, but they advised us to have a COVID swab for him. So they booked Zach for COVID swab, and that was on Thursday. That's it. We went home. He didn't have a fever when we went to the health center. So we were hoping that there would be no more fever over the night, but we were wrong. It's still persistent fever, persistent cough, and all that. There's also one episode that because of too much coughing, he had nose bleeding. It was like clotted blood. It was actually my wife who noticed that, and it was really like shocking to see him with full of blood on his face. Really, it was really like very shocking. So I was making myself composed to be very firm about the situation, that okay, let's just observe, probably it's just like a trauma because of too much coughing. So we let him sleep. We gave paracetamol round the clock still, the Nurofen and all that. So the next day, still persistent fever. It's not subsiding. So we went back to the hospital, to the A&E. They just checked the lungs of my son. It's very clear. They couldn't hear any crackles or wheezing. Zach has history of asthma. They actually advised for Ventolin nebulization, also inhaler. And even though my son was very sick, he was very cooperative with all the management, really. So we were discharged from Connolly Hospital, and we had an appointment on that day as well for Zach's COVID swab. So we went to the swab center and went home afterward. So on that day, I was already feeling very ill and unwell, but only during the night that I had a sudden spike of temperature. So I took paracetamol, I just rested and sleep. And on the next day, it turned out that Zach was tested positive. So during that time, we were like, wow. So it was really shocking. Our anxiety levels skyrocketed, really. So after a moment of disbelief, anxiety and fear, we collected ourselves and did what we had to do. So on my side, I contacted my manager, I contacted the occupational health, and also HSC. So I was advised by the HSC to have a test as well, even though I am fully vaccinated, and also my wife. So we had the test on the same day, which is Friday, and the result came out the next day, Saturday. And unfortunately, I tested positive and my wife is negative. My wife had the symptoms last year about this, loss of smell, cough, fever and all that. I had a test last year and it turned out negative. So we were like laughing about that. Hey, you really had the COVID-19 last year, so your antibody is really, really good. That's why you're negative, and I am positive, even though I had a Pfizer vaccine. On Saturday morning, that's July 3, so we went to Temple Street Children's Hospital. So that's in city center of Dublin. And this is after we were advised by DDoc to consult the emergency room. So we went there. So they faxed actually the referral from DDoc to the Temple Street Hospital. So we went there and we were thinking actually that he will be admitted because he didn't have any appetite, the fever is still ongoing, the cough still persistent, and also his asthma attack. We actually packed all the things that he might need if he will be admitted. So they went to the ER, my wife and my son, and then I just stayed in the car. And after a few hours of checking, he was advised to have this Ventolin inhaler, 6 puffs. He actually was relieved with that. So my wife talked to the doctor about the possible course of action. Actually did not advise my son to be admitted, and we were happy. So we went home, we continued all the management and all that, and slowly we see improvement in Zach's situation. So he didn't have this persistent fever anymore, but the cough is very terrible. Decreased appetite, but he's still drinking a lot of water, which is good. So since myself and Zach were tested positive, we just stayed in the room just to isolate ourselves because my wife is negative. So we don't want her to be affected with the virus, and all of us were wearing masks except for Zach because he's not very comfortable with the mask. So I just kept myself with the mask on, and my wife as well, just to protect her from getting the virus, So that was a hell of a week for us from June 28th until July 4. So we were just very thankful to all the people who actually sent their best wishes, and to our relatives here, Tita Sally and Tito Bong. I received a call from PJ, Pinoy Nurse Adventure. Thank you so much for that. I really appreciate it, man. Thank you so much. And a lot of messages from different people. We actually did not give any specific details to our family back home because we don't want them to worry. So the following week is a better week for us. So Zach started to have appetite and the fever is not very severe now. So what we noticed about Zach since he had the COVID or the symptoms since Monday last week is that he is very sleepy. Like he sleeps like most of the time, and we just let him do that because we know that he's not feeling well. And the cough was really terrible, guys. It was really difficult for him, guys. For myself, I only had the fever on Thursday, so that's just one episode of high temperature, and then afterwards I'm okay. Since Saturday until I think Tuesday of this week, I had anosmia. That's loss of smell and also loss of sense of taste. I was telling to my wife, I didn't know that's really true, because sometimes if we have colds, you don't have a sense of taste. But this one is really terrible, guys. I really couldn't smell anything. So Saturday, Monday, and Tuesday, I started to have the sense of taste back there. So we were thinking, yeah, probably Zach also had that condition during those times because he didn't have any appetite. So this week, guys, we contacted the GP again and we booked an appointment. That was Monday. So we had the phone consultation with his GP. So we were given antibiotic just to treat any bacterial infection alongside with the viral infection. So he actually responded very well with the antibiotic. So this week is a blessing for us. So we were getting better. Okay, I am fully recovered, I should say. My son is almost there. So we are very thankful to the Lord with all this grace that He's giving to us. So since this is COVID-19, guys, we received a lot of calls from the HSC. Contact tracing was also done. So all our contacts were taken. So the big question is, guys, where did we get this virus from? You know what? At this point of time, it's not like who to blame already. But we were thinking that we got this, or Zach got this because he experienced the symptoms initially, that he got this from the school. So probably he got it from there because I was telling to the contact tracing agent from HSC that I never handled COVID patient for the last month, but probably I'm communicating or in contact with COVID carrier. Okay, so I don't know. But anyway, guys, we are okay now. And lastly, guys, I just want to give a big shout out to HSC with their contact tracing, with their COVID testing facilities, and also the healthcare management from the GP to the DDoc to the hospital. It is like well coordinated, and we are just very thankful because number one, we did not pay for the swab. It's free. And for the DDoc or the North Doc, we did not pay anything. With the consultation with the GP, we did not pay anything because we have a card, under 6 card. And with regards to the hospital, Connolly Hospital consultation, we had to pay supposedly 75 euros for each consultation, but it will be taken care of by the GP. And we are praying that this kind of management will apply all over the world, not only here in Ireland, but in the Philippines especially. Hopefully that the management, our healthcare system will get better. So there you have it, guys. I'm just happy to inform you guys that we are recovering well. And once again, thank you so much for all your well wishes. So I am back, okay? So I'll see you on my next video, and I hope that you are doing well. And once again, guys, please do not take COVID-19 for granted. Still wear your mask, your face shield, and do all the precautions to protect yourself and your loved one. And once again, I'll see you on my next video. All right, bye.